Health Alliance Hospital recently announced plans to close a 15-bed psychiatric facility in Pittsburgh because of budget cuts as well as changing patient needs. One of the reasons they've cited for layoffs and closures is the decline in reimbursement under federal healthcare regulations. Proponents of the new healthcare bill have said that it will not adversely affect the quality and availability of care. Please outline a way that you will make sure healthcare quality does not decline and changes to the industry move forward.
If they lied when you said that, it is being affected adversely. Costs are going up and care is going down. We need to repeal Obamacare. Obamacare cannot be fixed. It will be the destruction of the best healthcare system in the entire world. Mr. Olver is going to tell us that we rank very low in industrialized nations in preventable death. That is untrue. We rank very well. The problem is the record keeping does not take into consideration that we have a high standard of living where we all have cars, we have accidents, people die on the roads. There are many things not factored into the numbers he's going to give you. To answer your question directly, what can be done to prevent care from slipping? We can get the federal government out of this because the federal government has no mandate, according to the Constitution, to do anything with the health care. But the states can allow patients to choose any insurance that they choose. The states can allow for health savings accounts where we are connected to our doctors, where the quality of care will increase and the cost of care will come down because we are directly connected with our doctors. Right now, there are 27,000 billing codes where doctors have to do more things to you for more money, and they're paid less because Medicare payments are going down, Medicaid payments are going down because of Obamacare. We need to get the government out of the way and allow the free market to function properly. If the free market functions in our healthcare, costs will go down, availability will go up.
Thank you, Mr. Gunn. Mr. Olver, you have a minute and a half.
Well, first of all, Mr. Gunn would like to repeal the healthcare bill. Probably, to me, the most useful part of the healthcare bill is the expansion of the community healthcare systems, which is what Community Health Alliance Connections is part of. That bill provides for a doubling of the community health care center system in this country so that it serves 40 million people instead of only 20 million people. And that would be largely people of low income who otherwise would have a great deal of difficulty getting health care. Mr. Gunn has also repeatedly said to repeal that. Well, I would suggest that the end result of that would be to put all of our health care back in the hands of the insurance companies. The insurance companies would then be in the driver's seat again. That the health care bill puts heavy constraints on the insurance companies and the way they operate, takes the abuses out of the private insurance system, and makes certain that they reduce their overhead, which is an enormous overhead that is involved by the private insurance companies. So you get a lot of bad things that happen when you get about trying to repeal the health care bill.
Thank you, Congressman Olver. Mr. Engel, you have a minute.
We have the same problem in Northampton where Early Dickinson Hospital is cutting health care like crazy. Contrary to Mr. Gunn, it's the free market that creates this problem because healthcare is a profit-making commodity in this country, and so they cut patient care to make a greater profit. Contrary to what Congressman Olver is saying, in fact, Obamacare enshrines the insurance companies in charge of our health care and layers it over with 2,500 pages of federal regulation, the worst possible combination. I would like a reorganization of the health care system, which provides universal coverage, but to put the power of our health care in the hands of consumers and in the hands of healthcare professionals, and even if it has to be partly mandatory, allows for consumer choice, and that is not necessarily inconsistent.